Okay, next slide, Rachel. So the things that we know now that we didn't know before, there is no increase in pregnancy mortality from the coronavirus in a pregnant woman compared to non-pregnant women. They may have increased morbidity, such as they may have a higher rate of going on the ventilator. There is a rare documentation of transmission to the fetus. One of those occurred here at MUSC. Women with COVID virus, COVID are actually higher risk for preterm delivery, and most of this is iatrogenic. And I still don't know the implications in early pregnancy. Does it cause any problems with malformations, or does it cause any long-term neurological problems, or does it increase the risk of miscarriage? Next paragraph. So COVID, we know that 80% of the patients have mild or no symptoms, 15% require hospitalizations, and 5% remain critically ill. Now, this has not changed since the beginning of the pandemic. We still don't know the long-term sequelae. For example, there may be pulmonary problems, there may be cardiac problems, and there may be neurological problems. The United States has been very aggressive with treating these patients, and since the pandemic started, our death rate is down 18%. The standard treatment for patients requiring oxygen and having pneumonia is still steroids and remdesivir. Convalescent serum is unclear whether or not it makes a significant difference. Now, our president got Regeneron. So what's the difference between that and convalescent serum? And basically with Regeneron, it is just a lot of a concentrated amount of antibodies to COVID, whereas convalescent serum, the antibodies to COVID are very diluted. Now, when the president got it, there was about 300 people in the country that had been tried on, and the antibodies are very safe, so they didn't take any risk with his health, in my opinion. And the preliminary data that has been published, it says that it looks like it decreases the length of the course. With pregnant women as well as other patients, we need to not forget DVT prophylaxis, especially in the critically ill patients. Next slide. So the prevention of coronavirus, I think this is very important in our African American population. So if you've heard now that African Americans do much more poorly than Caucasians with the virus, and there has been like 3 or 4 articles talking about vitamin D. So while vitamin D is a vitamin, it also does immunomodulation. So if I was going to just say to somebody, take 5,000 international units of vitamin D from September through March, okay? Because that, our sunshine is too weak now to give us vitamin D, and it doesn't matter if you sit out at the beach or not. And then in the summertime, I only decrease that if these are individuals that are still going to the beach and sunbathing. Now, sometimes, I mean, in Dillon, the patients I see from Dillon, I mean, I see levels of 5, 7, and you want your levels to be above 40 nanograms per ml. So for every 1,000 units, international units of vitamin D, it raises the serum about 5 nanograms. So if I got 5, the level's 5 and I want it 40, then that's 35 different. So I want them on 7,000 international units of vitamin D. And I want to repeat that in a couple of months. Vitamin C, 1,000 milligrams a day. And zinc, there is a significant amount of data that zinc decreases viral replication in the flu. And so I would recommend taking 35 to 50 milligrams of of zinc a day. Now, if you go back and look at what our president was put on when he went to Walter Reed, he was put on vitamin D and zinc. And initially, there was a question of whether or not we could take steroids, I mean, NSAIDs like Motrin and that type of stuff. And the answer to that is yes. Next slide. So the testing hasn't changed a lot. The PCR nasal swab still is the gold standard. And the antigen test, okay, are rapid tests that you can get back in less than 15 minutes or less than 2 hours, but they are less sensitive, which means they are less likely to be positive with the disease than the PCR. So the antibody test that's most out there most likely is IgG, but it takes 14 days for this to appear. And the collection site thus far that is the most reliable is the nasal pharyngeal swab. Now, I don't know what labs y'all use, but for example, we do a cheek swab at MUSC, and we have done enough of them and looked at their PCR too to know that if you present with symptoms, our cheek swab has a 92% sensitivity. So it's not 100% at all. Next slide. The antibodies, I will say, they too have a different sensitivity and specificity, and they are just highly variable. I just included this slide for reference in the slide set. Next slide. So what can we expect? We had a little hump when we, at the end of March, beginning of April, when we were all on lockdown or isolation. And then we had another hump after Memorial Day. And it lasted to mid-August. So what is being said now, okay, the purple line past today is, can I show it? Can you see my arrow?
I'm using the arrow, so if you'd like to tell me where to point, I'm
okay. Point to the purple line after today. Yes, right there. So if you look at that, that is the projected cases for, this is for the United States, but South Carolina mirrors this. And if you look, it is about the same height as the first wave of sickness in the United States. So if we do not continue to wear masks and continue to use good hand hygiene, the red line after today is what happens with easing of restrictions. I actually looked to see what percent of the American population is actually wearing masks, and about 70% are. And if we had 100% mask wearers, we would be down at the green line. And I was really surprised that so many people were still social distancing. I mean, trying to only do what they needed to do in social distance, because that was above 50%. Next paragraph. Why should we expect this? Well, I don't know about y'all, but I am getting COVID fatigue. I hate the mask, can't stand the mask. I used to be so vigilant, and I wore it from the hospital to my car, and I would only take it off once I got in my car. And I have just been like, the minute I leave the hospital and get outside, I take it down. We also have the holidays. My family has had a Halloween party for over 35 years. They have a cookout, and it's for all the children, and they have costume contests. And this was the first year we basically canceled it. Okay? But what did we do? The families broke down, and some families were bigger than others. So some had a 35 people gathering or 40 people gathering, and others had 20 people gathering. And so, yes, we didn't have 150 people at one site, but we still probably had too many people at one site. And people are inside, and the longer we sit inside and exhale, the more likely we are to put the virus in the air, and there are more places open. Next slide. So again, this is what we can do. This is nothing new. It's like the Swiss cheese model. Nothing is perfect for intervening and preventing the spread. But if you do each one of them, at some point, the the virus gets less and less how much it is passed to you, like the physical distance, the 6 feet or more, the ventilation system of where you are, outside versus inside, whether or not you're wearing a mask, whether or not you're using good hygiene. And then testing is important, so we can do contract tracing and surface cleaning. Next slide. So the last thing, and I couldn't remember if Barry was going to talk about this next week, but vaccinations. Please encourage everyone to get the flu shot. In our best years, our uptake for flu shots is 50%. So everybody has all their hope pinned on a vaccination for the coronavirus. So even if we have vaccinations that work and build up antibodies, then it's going to be in very limited supply initially, and it's going to take a while for them to ramp up to get enough to produce enough vaccines for the American population. And experts think it's going to be similar to the flu shot, and 40 to 50% of people will uptake it. And the effectiveness, like how good is it at preventing COVID infections, we probably won't know, because the endpoints are building up antibodies. And the duration of how long it'll work, we don't know that either. So I'm going to stop and ask if there's